Hello, everyone. My name is Mike Herndon. I'm the Chief Medical Officer here at the Oklahoma Healthcare Authority, and I want to make some brief introductory remarks, and then I'll kind of take you through what this brief meeting will look like and give you some further instructions. First of all, I do need to let everyone know that this managed care prior authorization focused webinar is intended strictly to focus on medical prior authorizations, that being durable medical equipment, medical big prior authorizations for MRI, CT scans, procedures, et cetera, and therapies. This particular webinar will not focus on behavioral health, dental, or pharmacy. So if you are on here thinking that we were going to address behavioral, dental, or pharmacy, and you want to leave now, you certainly can do that, or you're welcome to stay with us. So first of all, I want to make sure that everyone knows this is purely today to deal with medical prior authorizations. Let you know also that we do plan to have future webinars that will address these other prior authorization topics, but just not today. So stay tuned. If you're in one of those three categories, pay attention to our future webinar announcements. And then also to let you know that we understand this is a very brief time. We only have 30 minutes together, and that we will not be able to address each and every question today in this 30-minute time, but we will address those, we promise you. So we plan on, not only are we recording this webinar for future viewing, but we're also planning to post all questions and answers on the OHCA SoonerSelect website. That will happen in coming days. It will not be tonight, but it will be in coming days. And we will be posting in the chat function the link for where you can find the questions and the answers. And for the recording. So that will be posted in chat. Also, let me ask you to please only put questions in the Q&A box and not in chat. So please, if you have questions, let me remind you that to put them in the Q&A section and not in the chat, or else we may miss them and not get to them. That is what we're monitoring. All right, so the flow of this is going to be Dr. Paula Root, who is our Senior Medical Director and has supervision over the Prior Authorization Department. We'll be given a brief PowerPoint to kind of hit the highlights of the prior authorization functions within the managed care model. And then after that, we will have some of our prior authorization staff monitoring questions, and we'll be answering some questions. And they can introduce themselves at that time. And then at the end of the webinar, we'll have some concluding remarks. So Dr. Root, if you don't mind, take it away and give us the PowerPoint presentation, please.
Great. Thank you, Dr. Herndon. So today we're going to talk about prior authorizations, and this is as we move into the managed care realm. I just wanted to point out before we start, we have two big changes coming up here at the Healthcare Authority. We have Medicaid Expansion that will occur on June 1st. That's not what we'll be talking about today, because the management of that will continue under the Oklahoma Healthcare Authority. What we are talking about today is, as we move into the managed care realm, the prior authorization process at that time. And that will occur on October 1st. And as you guys know, on the medical side, we have contracted with 4 different managed care organizations that will be running the managed Medicaid, sorry. So next slide, please. So just a quick overview of what populations will be moving and staying. In our Sooner Care program, we will be keeping certain populations. So these are the age blind and disabled, the dual eligibles that are Medicare and Medicaid, members that are enrolled in Medicare savings programs, and American Indian Alaska Native members will default to Sooner Care, but they may opt in to a managed care plan. So it's voluntary for that population. Next slide, please. Populations that will be moving to managed care, the Sooner Care children, pregnant women, parent and caretaker relatives, expansion adults, and again, these are this is the Medicaid expansion that will occur on July 1st. They'll be moving to managed care, and these are adults age 19 to 64 that are less than 138% of the federal poverty level. Former foster children and then juveniles involved in foster care are receiving adoptive assistance. And not on this list, but as I mentioned before, American Indian Alaska Native members may opt in to the managed care program. So what kind of things will be covered under managed care? Well, the managed care organization must ensure access to medically necessary covered services. And the medically necessary covered services must be no more restrictive than those used in the current Oklahoma Medicaid program. So in other words, the amount, duration, and scope of services offered must be no less than the amount, duration, or scope that is offered for the same service provided under the current fee-for-service Medicaid program. The MCOs may accept nationally recognized medically necessary criteria. So some of those might be Milliman care criteria or interqual criteria. And the MCOs may require a PA to the extent that it is currently required under the Oklahoma Healthcare Authority's policies and rules. And they may also propose some additional PA requirements, but those are subject to Oklahoma Healthcare Authority review and approval. There are certain services, though, that are considered exempt from a PA, and those will continue to be exempt from a PA under managed care organizations. Some services as well may have certain limitations, such as annual limitations or number of visit limitations or those kind of things as well. And one other thing that's not on this slide, but I do want to point out that EPSDT, the early periodic screening, diagnostic and treatment services, must be provided by the MCOs to all members age 21 and under age 21. So these include medically necessary healthcare, diagnostic, treatment, and other measures to correct or ameliorate defects or physical or mental illness, whether they are covered or not under the state plan. Next slide, please. So how will PA submissions work? And this is effective October 1st, 2021, when we move into the managed care realm. So effective October 1st, 2021, those populations that remain with the Oklahoma Healthcare Authority, and those were covered on the first slide that we looked at, those will continue to be submitted through the Sooner Care provider portal, and the prior authorization process will remain the same for those members. Any PA requests for the populations that are moving to the managed care organization will need to be submitted directly to the prospective managed care organization. So whichever of the four managed care organizations that health plan enrollee is enrolled with, that's where the PA will need to be submitted. The MCOs will be required to utilize a standardized Oklahoma Healthcare Authority developed PA request form if the request is being submitted in that manner. The MCOs will also have an electronic secure provider portal for prior authorization requests, and at their discretion, they can accept PAs over by fax or through telephonic means. If the MCO accepts PAs telephonically, there has to be a toll-free provider services call center, and that call center must be equipped to handle urgent PA requests 24 hours a day, 7 days a week. If a request for a new PA for a managed care enrollee comes into the Healthcare Authority after October 1st, this is not written on here, but it will be system canceled, and that provider or member will be notified that the PA must be submitted to the managed care organization at that time. So that is effective October 1st. If a member is enrolled with a managed care organization, the PA request must go directly to that managed care organization. MCOs also must put into place mechanisms to ensure consistent application of review criteria for authorization decisions and consult with the provider that requested the services when appropriate. And the MCO also has to adhere to certain turnaround times. So for a standard prior authorization request, the determination must be made within 72 hours. And for an expedited or an urgent request, that decision must be made within 24 hours. And by urgent, we typically mean if there is a life, health, or if there's the possibility of the member not being able to regain maximum function, if any of those things are jeopardized, then that would be considered an urgent request. And one other thing on the timelines, so for the standard prior authorizations, it's a 72-hour turnaround. For an expedited, it's a 24-hour turnaround time. But there are some situations that that the managed care organization may get an extension of 14 days. So if there's additional information that's needed and that extension is in the member's best interest, that extension can be granted. And there are certain things that that must be done within 24 hours, other than what we define as urgent requests. And those are things such as behavioral health inpatient PAs. Next slide, please. So we do recognize that there will be some existing prior authorizations that went through the Oklahoma Healthcare Authority prior to October 1st. And so we want to make sure that the transition of care processes are in place to ensure continuity of care for those members that have prior authorizations pre-existing MCO implementation. So prior authorization approvals for members who move to managed care organization must be honored by that managed care organization for 90 days following the enrollment in their managed care organization. SoonerCare prior authorizations for members enrolled in a managed care organization will be end dated as of December 31st, 2021, and notification will go out to the member and the provider. So if there is a member that has that, we will run a roster of MCO enrollment, and we'll run a roster of active PAs that are out there for those members. And we will then notify the member and the provider that as of December 31st, that PA is no longer effective and they need to contact the managed care organization for a new prior authorization. I think that's it. Next slide, please. Lastly, when there is an adverse benefit determination, the managed care organization must give adequate notification to the member and the provider, and they must have a peer-to-peer option and ensure appeal rights for that member. So if there's an adverse benefit determination, the notification must go out in a written and sometimes in an oral fashion to the member and provider. If the adverse determination was for termination, suspension, or reduction of previously approved services, then that written notice must go out at least 10 days before the date of that action. There are some exceptions to that, but that would be situational. If the adverse benefit determination was for a standard prior authorization, denial, or limitation, then that notification is not to exceed 14 days following receipt of a request for the services. And if the adverse benefit determination was related to an expedited request, then there needs to be oral notification as expeditiously as the condition requires, and it should be followed up with written notification in 72 hours. A peer-to-peer option must also be available, and that applies to all authorization denials or limitations of amount, duration, or scope of service. And lastly, there must be an appeal process as well. In this, there's a first level appeal and a second level appeal. The first level appeal goes directly to the managed care organization. And this may be initiated by the member or by an authorized representative of the member. And the provider may be an authorized representative for the member. So that's a change for Sooner Care members, is that the provider may now appeal on their behalf. The appeal must come in 60 days from the adverse benefit denial, and it may be either oral or written. The company must resolve a standard appeal within 30 days. And again, there could be a 14-day extension for that. And it must be followed by written notification of the appeal determination. For an expedited appeal, the determination must be made within 72 hours. And there must be both a written notification and an attempt at an oral notification for an expedited appeal. The second level appeal comes to the Oklahoma Healthcare Authority, and this is when the member submits a request for a state fair hearing. The request for a state fair hearing can only be done after the members receive notification from the MCO that the adverse benefit determination was upheld. And this request must come in 120 days from the adverse benefit determination. And there are some instances when benefits will be continued pending the appeal or the state fair hearing, but those can only be requested by the member and not by the authorized representative. That's it for the PowerPoint presentation. The next slide just shows the helpful resource. So again, you can go out to the Oklahoma Healthcare Authority website, to our SoonerSelect page, and where you can find information and where questions and answers to this will be posted. And I will turn it back to Dr. Herndon.
Okay, thank you, Dr. Root. Let me try and answer a couple of these questions. And first of all, I'm going to prioritize questions that are specific to the prior authorization process, since that is the intent of this webinar today. Just in general, let me make a few comments about covered services in general. The managed care companies do have the ability to do extended services other than what Sooner Care covers right now. They may decide to, they may decide not to. OHCA does have the partnership right, if you will, to discuss those services with the MCOs. But there was a question about in-home services like private duty nursing and home health visits and things like that, that yes, the plans will continue to do what OHCA covers. Might they cover some services that we do not cover currently? That is a possibility. They will have that option to do so. As far as there was a comment, I just feel like I need to answer real quick, although it's not related to PAs necessarily. It's about Centene saying evidently had shared that they would be the only MCO in the state taking Medicaid patients. That is only, Centene is the sole contractor managed care entity to take care of the SoonerSelect specialty children's program. In other words, children with special needs that have DHS services, et cetera. And there are some criteria for children who will go into that specialty plan, former foster care children, children currently in foster care, et cetera. More information can be found on the website about the SoonerSelect specialty population, but Centene is the only contractor for that population. But as Dr. Root said, we also contracted with Blue Cross Blue Shield of Oklahoma, United Healthcare, and with just drawing a blank on the fourth one. So it'll come to me in just a second. And so we will have we'll have 4 vendors for everything except for the specialty care children's population. And then as far as will there be specific timelines in the requirement of PAs for therapy, such as every 3 months or every year? So currently, OHCA, we will make approvals for up to a year for certain therapy services for children that obviously have special needs. The MCOs may choose to prior authorize at a shorter frequency of that. It will be up to them. And I do believe that the MCOs are capable of knowing children that are going to need continuous services for greater than a 90-day period, and that they will be approving those. But it will be up to them and they to determine how long they do want to make the prior authorization coverage for. How can you get a copy of the standard OHCA PA request form? That is being finalized with the plans as we speak. And once that is finalized, obviously everyone will want to be familiar with that. And I'm sure that we can post that on our SoonerSelect website, and the plans will be posting it as well. Let's see. Says, do you have any examples of needed requests that were approved and were denied to better assist us hands-on learners? I'm not really sure, how to answer that. But Jacqueline, if you have an answer or you've been following these questions, I'd be happy to have you weigh in.
Dr. Herndon, I believe Jacqueline was looking at some other questions. Can you repeat what you were wanting her to look at?
Yeah, I just didn't quite understand the question. I thought maybe someone, it's a question that, do you have any examples of needed requests that were approved and were denied to help better assist us hands-on learners? And I think I'd have to have some specific examples to the person who submitted that question or maybe some more clarity to be able to answer it. Let's see.
Dr. Herndon?
Yes.
This is Jacqueline. And one of the questions that came up, and I just wanted to read it so we could just answer that. It says, currently speech evals need a PA, OT and PT do not. Will that change? And I just wanted to, I know there's a lot of questions surrounding that. We've had a few different questions similar to that here in the Q&A, and that we just wanted to let the providers know that a lot of this will be up to the MCOs in how, if they're wanting to add additional PAs to services. And so I didn't know, in addition to that, if there was anything else you wanted to mention.
No, I think that's good. I just, in general, the plans will have flexibility to not require prior authorizations for some of the services that we currently prior authorize. We have not been given that information from the plans yet as far as to whether or not they plan to continue to require prior authorizations like we do. So at this time, it's not known if that will change or not. But you are correct that speech evals do require a PA. For dental orthodontic PAs, they usually file for the first, second year. Yeah, this will be addressed later. When we talk about dental prior authorizations, it will not be part of what we talk about today, but that has came up and we will have an answer for you.
There's
Dr.
a
Herndon?
question in here, I'm sorry, wanting to clarify whether existing PAs from Oklahoma Healthcare Authority for therapy would be canceled at the end of December and need to be resubmitted to the MCOs. So, and I think Natasha's in the room too. So if I'm misstating any of this, jump in there. But for all the prior authorizations for the members that enroll in a managed care organization, the Oklahoma Healthcare Authority will run a report of all the members that are rostered to each of the managed care organizations. And then we'll run a report of any active PAs that we have out there for those members. The managed care organization must honor those PAs for a 90-day period. But yes, as of December 31st, those PAs will no longer be effective. And so the managed care organization will at that time need to be contacted to issue a new PA. Now, there are some exceptions that are out there for to ensure continuity of care. So for instance, a woman that's pregnant, the prior authorization would be in effect until the 6-week postpartum visit. So whether that's beyond 90 days or not, that PA would continue to be in effect. And there are some situations for enrollees that are receiving chemotherapy or radiation therapy or dialysis, or in the process of a major organ transplant, or have a terminal illness. And so those might also extend beyond the 90 days. Children that are receiving private duty nursing, the prior authorization will continue until the managed care organization has completed a comprehensive assessment. But anyway, yes, the answer is if the member is enrolled in a managed care organization, the PA would be honored until 90 days after that date.
Okay, I'm sorry, our 30 minutes are up. The questions are starting to fly in now. So thank you for those questions. We will get all of these questions answered and they will be on our website again. That has been posted where you can find those in the chat box. So go there and you can see where to go to find the answers to the questions that you submitted. And let me circle back and remind myself and everyone that Humana is the fourth managed care plan. Blue Cross Blue Shield, Centene, which is Oklahoma Complete Health, named here in Oklahoma, and Humana and United Healthcare. Okay, unless there are any final things we need to address, Jonathan, we'll sign off. Anything final to say?
I think that's all we have over here. I just want to remind everybody that they can look for the recording and the Q&A in the coming days on our website. It'll be on the page you used to register for this webinar. That's oklahoma.gov/OHCA/town-hall, and just look for the PA webinar.
Thank you, Jonathan. Thanks everyone for attending, and look for the questions and the answers to your questions in coming days. Thanks and have a great evening.